Now, Plans for Good Health, brought to you exclusively by United Healthcare.
Before the COVID-19 pandemic, America faced a mental health crisis, and that only worsened during the pandemic, with a dramatic increase seen in those looking for help with depression and anxiety. This morning, we want to talk not only about mental health, but the stigma surrounding it. Joining us now for a conversation this morning is Dr. Kevin Stevens, the Chief Medical Officer for United Healthcare of Louisiana. Welcome back to the show, Dr. Stevens.
Thank you. So nice to be here with you again. I like your coat, man. It looks great. I mean,
Oh, come on. Are we matching today? I like your glasses as well. We will be twins today. Look, doctor, I want to thank you so much for talking about this morning. If people don't know, May is Mental Health Awareness Month, and I think it's so important that we talk about this topic. I want to first ask you, from a doctor's standpoint, how do you describe mental health and its importance?
Well, one of the things, 1 out of 5 Americans have some mental health issue. And in kids, it's like 1 out of 6. So it's a lot of people. And the way I define it, it includes your emotional health, your psychological health, and your social well-being. It's all of them things together. Because, sometimes emotionally you're down, we call it the blues. And psychologically, sometimes you get depressed, you get down, and then even your social well-being, you're isolated, you're secluded, you don't want to be around people, and those kind of things. So it's how you think, it's how you feel, and more importantly, it's how you act. And so all that determines what you do, how you go, what you get, and how do you handle stress, how do you relate to others, how you make choices, hopefully good choices. And many times your relationship with others are determined by this, because when you get down in the blues, sometimes you lose your friendships and you isolate yourself. But that's when you really need your friends in that time. So it's a very important thing.
No, it's so true, doctor. After the past couple of years, I want to show people some statistics. They're pretty alarming if you ask me, especially this one right here. 4 in 10 U.S. adults reported feeling anxious or depressed during the pandemic. Why do you feel that is? And talk a little bit more about these statistics and what you think when you see these numbers.
Well, of course, when you go back to the COVID-19 pandemic, what you find a whole bunch of things. Well, we all were quarantined. So we had a period of time to where you couldn't go anywhere. You couldn't go out to the stores. You couldn't go shopping. You couldn't go to games. They closed down the whole NFL. Can you believe it? I mean, no football. And so when you have the isolation, we all were stuck at home. And some of us, like myself, I'm an outdoorsy kind of a person. I like to get out and get amongst people, and I get my energy from people a lot of times. And so what happens is that when you have that, people start to get stressed out, because then the unemployment went up. I mean, because a lot of businesses couldn't afford to stay open because you couldn't open, you didn't have any customers. And then not only that, but we also had a lot of deaths. I mean, I can't tell you the number of people who I know personally who died during the COVID epidemic. And if they didn't die, a lot of people got sick. And then to put on top of that, you didn't know if you were going to be the next one that were going to come down with the virus. And so, and I have friends my age and younger who have all passed away because of COVID. So then there's some anxiety associated with, if you're over 50 or 60, you have diabetes, hypertension, any of the other obesity, you're at greater risk. And before the vaccines really got out and you got vaccinated, there was a period of time we all were vulnerable. So all of that just led to a basket full of mental health issues that I think
it was hard. Like, I'm not even gonna lie to you, doctor. I was in that group. It was very hard because we couldn't do the things that brought us joy like we used to, right? And when we're not doing those things that bring us joy, then we wallow back into that place, and we don't want that, But I'm curious, what are some steps that people watching this, including myself, can take to better manage and reduce, stress? Because, stress and mental health, there is a correlation.
Oh, that's a very, very good question. I think first thing you should do is make sure you eat right, sleep right, and get some exercise. I mean, we say it all the time, and I hate to keep repeating the same thing, but you know what? It really works. It works. Make sure you get 8 hours of sleep. Get a healthy routine. Get yourself on the schedule. You wake up and you eat a healthy breakfast, and then you walk around the block. I mean, you don't have to run 26 miles. You don't have to be a marathon runner. And actually, you just need 150 minutes a week or something of exercise. And you start with that. Then the next thing you have to do, get in touch with your feelings. Make time for yourself. Sometimes meditating, sometimes breathing in deeply, sometimes get in touch with your spirituality, going to a church, whatever your place of worship is. And sometimes just isolation, just yoga, meditating, reading a good book, or reading something self-help book that you kind of get into your own space. Watch a movie. Sometimes that's a good thing. To help you get in a little space in a better place. So give yourself a break, take time for your health, and make sure you check your health plan benefits. Many health plans have, like we have Sanbella, they have many mental health things that you can do. And they have the Metropolitan Human Service District. You can call them. They have mental health counselors that you may want to do, and talk to your friends. Like you. I love it. I like to talk to you. You bring a little joy. We wear the same coat kind of stuff, And so talk to your friends and tell them, you know what, man, I'm feeling down today. I have the blues today. And then you just talk through it. Be aware of it.
It's so true. And talking about mental health in general is something that I think we need to do more of. Have the conversations that we had today, Doctor. Thank you so much for joining us this morning. And hey, if you want more information about mental health, learn more by logging on to uhc.com.